Hey everyone, welcome back to the channel. Today we're diving into an important topic that could potentially save your life. We're talking about 10 wake-up calls your body might be sending you, signals you should absolutely not ignore. It's easy to brush off a little fatigue or a nagging cough, but sometimes these seemingly minor issues can be our body's way of telling us something's wrong. We're going to break down these warning signs, understand why they're significant, and most importantly, what you should do if you experience them. Remember, I'm here to empower you with knowledge, but I'm not a substitute for professional medical advice. So if you're experiencing any of these symptoms, please consult a healthcare professional for a proper diagnosis and treatment plan. Let's get started.
Our brains are incredible organs, constantly processing information, forming thoughts, and keeping us sharp. But what happens when our brain power takes a sudden dip? What happens when we experience sudden confusion, difficulty thinking clearly, or disorientation? These aren't just senior moments, folks. These can be warning signs of serious conditions affecting our brain function. Sudden confusion, often referred to as delirium, can be a sign that something's interfering with the brain's ability to function properly. One of the most concerning possibilities is a stroke. A stroke occurs when blood flow to a part of the brain is interrupted, either by a blockage or a rupture in a blood vessel. If you or someone you're with experiences sudden confusion, don't dismiss it as a senior moment. Seek immediate medical attention.
Let's talk about chest pain, a symptom that often sends shivers down our spines. And for good reason. Chest pain can be a sign of something seriously wrong with our heart. Now, not all chest pain is created equal. Sometimes, it can be caused by something as simple as heartburn or muscle strain. But when it comes to our heart health, it's always better to err on the side of caution. One of the most concerning causes of chest pain is, of course, a heart attack. A heart attack occurs when blood flow to a part of the heart muscle is blocked, usually by a blood clot. Chest pain during a heart attack is often described as a crushing pressure, tightness, or a squeezing sensation in the chest. It can feel like an elephant is sitting on your chest, and it can radiate to your arms, jaw, back, or even your stomach. If you experience chest pain, especially if it's severe, comes on suddenly, or lasts for more than a few minutes, call 911 or your local emergency number immediately. We've all experienced headaches, those throbbing pains in our heads that make us want to curl up in a dark room and disappear. But what about headaches that are different? Headaches that are so severe and sudden they stop us in our tracks. Those, my friends, are the headaches we need to pay attention to. A severe headache, especially one that comes on suddenly and intensely, can be a sign of something serious happening within our brains. One of the most concerning causes of a sudden, severe headache is a brain aneurysm. An aneurysm is a weak or bulging spot on a blood vessel in the brain, and if it ruptures, it can cause a life-threatening bleeding in the brain, known as a subarachnoid hemorrhage. Another potential culprit is a stroke, which occurs when blood flow to a part of the brain is interrupted. If it's the worst headache of your life, if it comes on suddenly and intensely, or if it's accompanied by other neurological symptoms like vision changes, weakness, or numbness, seek medical attention immediately. We've all experienced coughs, those sudden expulsions of air from our lungs that can range from a tickle in our throats to a chest-rattling hack. Coughs are our body's way of clearing irritants and secretions from our airways, and they're often a symptom of common colds or allergies. But what about a cough that just won't quit? A cough that lingers for weeks or even months on end? That's when it's time to pay attention, because our bodies might be trying to tell us something important. A persistent cough, typically defined as a cough that lasts for 8 weeks or more in adults, is often a sign of an underlying medical condition that requires attention. One of the most common culprits behind a persistent cough is postnasal drip. This occurs when excess mucus from our nasal passages drips down the back of our throats, triggering a cough reflex. Another possibility is gastroesophageal reflux disease, or GERD, a condition where stomach acid flows back up into the esophagus, irritating the throat and triggering a cough. A persistent cough can also be a sign of more serious conditions like asthma, chronic obstructive pulmonary disease, or COPD, or even lung cancer. Asthma is a chronic respiratory disease that causes inflammation and narrowing of the airways, leading to wheezing, shortness of breath, and, you guessed it, coughing. If you have a persistent cough, especially if it's accompanied by other symptoms like coughing up blood, unexplained weight loss, or chest pain, seek medical attention. Our eyes, those remarkable organs that allow us to perceive the world around us, are precious. We often take our vision for granted until something changes, until we experience a sudden blurriness, double vision, or flashes of light. These changes in vision are not something to ignore. They can be our eyes' way of crying out for help, signaling that something might be amiss. Sudden changes in vision can be caused by a variety of factors, some more benign than others. However, sudden changes in vision can also be a sign of more serious eye conditions that require prompt medical attention. One such condition is retinal detachment, a medical emergency where the retina, the light-sensitive layer at the back of the eye, pulls away from its blood supply. If you experience any unusual visual disturbances, such as blurriness, double vision, flashes of light, floaters, or vision loss, seek immediate medical attention. Our bodies are incredible, intricate systems, constantly changing and adapting. We feel every bump, every ache, every sensation. But what about when we feel something different, something new and unusual? What about when we discover a lump or a bump that wasn't there before? That's when it's time to pay attention, because our bodies might be trying to tell us something important. Finding an unusual lump or bump, especially one that's hard, painless, and growing, can be a cause for concern. Now, not all lumps and bumps are created equal. Some are harmless, like lipomas, which are benign fatty tumors that feel soft and doughy under the skin. However, some lumps and bumps can be a sign of something more serious, like cancer. If you find an unusual lump or bump, it's always best to err on the side of caution and have it checked out by a healthcare professional.
Thanks for watching. If you found this video helpful, make sure to give it a thumbs up and subscribe for more health tips. Remember, your health is your wealth. We covered a lot of ground today, from unexplained weight loss to persistent coughs and unusual lumps. These wake-up calls, these subtle and sometimes not so subtle signs from our bodies are crucial to pay attention to. Remember, early detection is often key when it comes to effectively treating and managing health conditions. Take care and see you next time.